Hello, today we're going to talk about posture. It is a question that gets asked by pretty much all of our patients. I think it's probably to do with the fact that posture is part of every single activity we do during the day, whether that's walking, sitting, standing, pushing a buggy along, carrying shopping, cycling, anything. It is what our body is doing, positioning in space. So we have to think about it in context of that so that we can incorporate it into absolutely everything we do. It's not just something you suddenly think, oh, sit up straight. So the two things I'm going to talk about today is really simple. I don't want to overload anyone with too many things to think about. So we're just looking at the upper body posture. Hopefully if you can manage to think about two things, especially in the upper body, we're talking about the head and the chest here, everything will sit nicely underneath, so your hips and your pelvis. There's a lot of complicating factors with posture, what's going on with your feet, your hips, your knees, muscle imbalances, everything like that, but I'm going to keep it really simple and really plain so that, and this applies to pretty much everyone. If you are getting any pain at all when you're trying these simple tricks out, then please come and see an osteopath or speak to your GP, and they can look into what else might be going on, because it's really important to make sure that nothing else is going on and you stay nice and pain and injury free. So if we start with the chest, I'm going to start and face away. So we are talking about lifting the chest. So if I do a classic slouched posture, which lots of people have if they're using their phone or on a laptop, or even reading a book, everything is forwards, everything is hunched and closed off in the middle. The reason this isn't very good is your ribs need to be elevated to expand really nicely. Your diaphragm sits in a nice dome, and when it contracts to draw air into the lungs, it flattens out. So you want to allow your diaphragm to be able to do that. And a poor posture like this doesn't allow you to do that. So what I want you to imagine is you've got a hook on your chest here, so right in the middle of your sternum. If you pinch your skin, it shouldn't be painful, if you pinch your skin and you imagine, so if I start with this poor posture and I lift up, like I've got a piece of string attached to that hook and it's going forwards and up in a almost vertical but not upright. I don't want you sort of leaning backwards and being pulled up that way. It's going forwards and up. So you're lifting up that way. And you can see immediately, if I start here and I do that lift, my shoulders slip back into a really nice position. And what happens with your shoulders, instead of being forwards, they slide round your rib cage. And as you lift up, they rotate and they drop nicely into a pocket at the back. So you're not having to use any muscles to pull back to sort of drop the shoulders and sort of bring them back. You're not having to do any work to do this posture. It's a lift and the shoulders drop. It allows these muscles to stretch nicely, which will then allow them to work when you actually need them to work. So they're not working unnecessarily. The next thing I want you to think about is the positioning of your head, and it's the same kind of thing. So if I turn away again, if I imagine the head dropping forward again, let's talk about that text neck. If your head is dropping forwards, the weight of your head is putting a strain across all of these ligaments and muscles of your back. That can cause headaches, breathing problems, chest and neck pain, shoulder pain. The list is pretty much endless. So what I want to be thinking about, again, we'll use the analogy of hooks. If you imagine there's a hook just behind your ear, if you feel behind your ear, you can feel the sort of lumpy process in your of your skull. Imagine there is a hook there, and I want you to imagine it's being pulled in a J shape up. So you're bringing it up and up that way. So again, this is slightly more upright, but what it's doing is it's elongating the back of your neck and it's tucking your chin in, but you're not pulling your chin in, it's being drawn up that way. And those are the two things I want you to think about, and that is it. Have a nice day.